Well, good afternoon. My name is Nora Triola, and I'm the Chief Clinical Officer. And today's Friday, July 3rd, 2020, and I'm here doing our solo YouTube today. David's taking a much needed vacation. We have some important topics that I'd like to cover. First is our understanding of the safe vacations. As I'm sure many of you are thinking about, July 4th usually signals vacation. So we want to talk a little bit about vacations and some of the new travel advisories. And then, as David always does, we want to share a little gratitude and a wonderful story that comes from one of our service offices. So let's get started on today's CEO COVID-19 update. So as I said, I wanted to start with talking about safe vacation. You know, many of you are thinking about, gee, it's been a long time. We've been at this work now for a while. And I want to start thinking about vacation, but I want to do that sensibly and safely. So we've prepared a tool for you that's on the website and that will be included with the link, but it really goes over some important things that you should think about as you start to prepare. You know, clearly spreading and contracting COVID-19 is something we've all been worried about. And it gets even more worrisome as you think about, you know, being around large groups of people in unfamiliar areas and how much time you're going to spend with those individuals. So really making sure that you are doing the basics that we've been talking about all along. Wearing your comfort mask in the community and making sure that that comfort mask is tightly fitting around your face and that it covers your nose and your mouth and that you use that regularly when you're out in the community. I think it's sometimes easy to see other people and to have them come up to you and they may not have their mask on properly or they may have no mask at all. Please feel comfortable in asking them to wear their mask to help protect you as well. These are important times to remind and teach everybody about the importance of mask wearing. We also want to make sure that we're doing good hand hygiene and making sure that we're washing our hands regularly and that we're doing all our cleaning and disinfecting so that we don't inadvertently spread that virus, keeping our hands away from our faces, the good things we've talked about all along. There are also some important tools available for you for places you may be going that you want to check what they're doing as safety precautions before you plan your trip, so you know if they're up to your standards and you're comfortable with going there. Remember to think about what you may need in anticipating your needs. Make sure you bring enough of your comfort masks and your hand sanitizer, and that you're thinking about anticipating bringing those with you and not waiting till you get on vacation and finding that you need to go out and source those. And most recently, we have to be aware that the states are paying particular attention to a number of impacted states which are seeing a positivity rate increasing. And so states that have lower rates are saying, we'd ask you to quarantine when you are coming into our state from those states. And so there are travel advisories and emergency orders that I would ask you, if you're thinking about traveling on safe vacations, that you are familiar with. So you look at your state.gov and you see if there's a travel advisory and what that advisory actually asks you to do. So many of them are asking us to self-quarantine for a number of 14 days so that we don't bring an infection if we're traveling from one of those impacted states. So please, it's a fluid environment. Many states are issuing them just in time. I got one this morning, I got one last night. So really coming to fruition now. So stay on top of that as you plan your vacation. And remember that your director and leadership within the office is there to help you figure out how to safely plan a vacation, because we all know you've worked so hard during this time of COVID-19, and you always work hard to care for our clients in an exceptional way. And so we know you have earned that vacation, and what we want you to do is just make sure that you do it as safely as possible. And so just some tips that I think are important. That safe vacation tip will be on the website for you, as well as in today's announcement. So, and now playing David's role, you know, we'd like to move on to our really good news story and a real expression of gratitude. I think this picture, if you just don't even know anything about the story, you look at a beautiful woman who looks at home in her kitchen, and then the next freeze is a group of dedicated caregivers that are all smiling behind those masks and feeling the love for that client. And then the far right is what looked like biscuits. Well, let me tell you a little bit about this story. Miss Edna. Miss Edna is the picture on the left, and she's a wonderful home health client from North Carolina who unfortunately came down with COVID-19. Both she and her husband were diagnosed with COVID-19, and they spent more than 2 weeks in the hospital trying to recover. Unfortunately, Miss Edna lost her husband during that battle. But Miss Edna powered through. She was confined to a wheelchair, very, very debilitated. And we served her. And, you know, can you even imagine Miss Edna trying to manage through this, going home alone, you know, with the support of family members, but having lost the love of her life. And we were there. We were there to help her through that. And today you see pictures of Miss Edna with those caregivers that helped her get through this very critical time as she tried to recover and get back to the thing that she loved most, which was baking. And we're happy to report that Miss Edna in Salem, Winston-Salem, North Carolina, is now no longer needing our services. She's been discharged, and she's back baking those marvelous biscuits. And so for the team that cared for her and for the teams that care for all of our clients, we are so grateful for all your hard work. We know that these are some of the most critical clients that we've seen in a long time, battling and trying to get back to quality of life after a diagnosis of COVID-19. And this is just a wonderful example of one story that goes on across the 23 states in which we serve. So I think in closing, again, we are extremely grateful, and I wish each and every one of you a wonderful, restorative, safe 4th of July holiday weekend. And please know how much we appreciate all you're doing to care for those clients in our communities.